While some medications are used during a migraine attack, preventative treatments work differently. Preventative treatments are taken on a regular schedule, often daily, to help reduce how often migraine attacks happen and how severe the attacks can be. You want to talk to a healthcare provider about preventative options if migraine attacks are happening 4 or more times a month, lasting a long time, or interfering with school, activities, sleep. As soon as migraine becomes disruptive, talk about preventative treatments. Some preventative treatments start with vitamins or supplements that support the body's systems involved in migraine. These may include things like magnesium, riboflavin, vitamin B2, feverfew, or CoQ10. Even though these are sold over the counter, it is important to know that supplements are not regulated in the same way prescription medications are. That doesn't mean that they can't be helpful, but it does mean that quality and dosing can vary between products. It's still important to talk to a healthcare provider before starting any supplement, especially to make sure the dose is appropriate and safe. There's a lot of information when it comes to supplements, and we are going to have another video that goes deeper into this subject and other lifestyle strategies that may help support migraine management. There are prescription medications doctors sometimes use to help prevent migraine attacks from happening as often. One thing that may be a little surprising is that many migraine medications were first created to treat other health conditions. Over time, doctors discovered that they can also help calm the brain systems involved in migraine. For example, a medication called amitriptyline affects certain brain chemicals that play a role in pain and sleep. Because sleep and migraine are so connected, this medication can sometimes help with both. Another group of medications is called beta blockers. These were originally developed for heart and blood pressure conditions, but they can also help steady the body's stress response, which may reduce migraine attacks for some people. For younger kids, doctors sometimes use a medication called cyproheptadine, which is actually an antihistamine. It can affect certain brain signals involved in migraine. There are also anti-seizure medications like topiramate or valproate that help calm overactive nerve signals in the brain. Because migraine involves changes in how brain signals fire, these medications can sometimes help reduce attacks. A healthcare provider can help decide if any of these options might be helpful based on age, weight, symptoms, and overall health. There are also newer treatments being developed that are specific for migraine. One example is a type of medication called a CGRP blocker. CGRP is a protein involved in migraine attacks that helps send pain signals and increase inflammation. These medications help block that process and turn down migraine activity in the nervous system. At this time, May 2026, fremanezumab, brand name Dojolvi, is the only approved CGRP for preventative treatment of episodic migraine in youth ages 6 to 17. Because migraine research is moving forward so quickly, new options may become available over time. Preventative migraine care is not always just about medication. Some kids and teens also benefit from tools like mindfulness, relaxation training, or cognitive behavioral therapy, sometimes called CBT. These approaches can help students better understand how stress, pain, sleep, and the nervous system all work together during a migraine attack. For families, these tools become an important part of a larger migraine management plan, alongside medication, lifestyle changes, and support at school. We also have other videos that go deeper into these strategies. Preventative treatment is about building a plan that works best for you and your family. That plan may include medication, lifestyle habits like sleep and hydration, stress management, and other tools that support the brain and the body. For most kids and teens, the goal of preventative treatment is simple: fewer migraine attacks and more days just feeling like themselves. If migraine attacks are happening often or they're making daily life harder, preventative treatments may be something to discuss with a healthcare provider. Working together, you can find a plan that helps your child stay engaged in school activities and the things they enjoy.